Well, Australians are being urged to join a campaign pushing for cheaper private health insurance called the Big Health Insurance Switch. The goal is to get 25,000 people to register, then use that collective buying power to negotiate a bit of a discount. Figures show the cost of private health insurance has doubled in the last decade. And in April, prices will rise again, double in the last decade. Christopher Zinn, campaign director for One Big Switch. Those figures are shocking. Tell us, how's this big switch thing working?
Yeah, well, it is. It's, increases of 5.6% a year, but that actually really mounts up, it compounds. So that's the shock that people are actually getting.
Yep.
The idea is that we create a group. You may remember the big electricity switch last year. It's the same for private health insurance. That can be $4,000 cover for a family in terms of hospital and extras. So it really mounts up. We think people who work in banks and universities and some other places get a discount. We think all Australians should do it, and this group can create that.
So what do we do? We're sitting out there watching our TV this morning. What do we do to get in?
Go to bighealthinsuranceswitch.com. You just register with your name and email. There's nudging 9,000 already since we launched yesterday, so we might break the 25,000 barrier. But then we can actually, over the next 4 weeks, gather together that group, open negotiations with the insurers and see if we can deliver a discount.
So whichever insurer you're with, whichever private health insurer, you can go and register.
Yeah, exactly. It's really just throwing your hat in the ring, and we'll see what people power can deliver. And I say it's worked. We've done banks and electricity in the past. We believe it can happen for private health insurance too.
Look, you hear a lot of people saying, I don't get that much back. Do I need private health insurance?
Well, if you don't, you can face various government sticks, if you like. And so there's the Medicare levy surcharge, 1.5% extra for those on a higher income. And also, if you're aged over 31, an extra 2% on the premium. So there are rebates for those who have it, but again, they're means tested as of the beginning of this financial year. And many people who are again on higher incomes have lost that. So there's a lot of change, but more to the point, there's a lot of confusion. Many people are actually not with the best possible plan for them. And again, part of this process is to make people look again at their cover and see what suits them best. Yeah,
on that point you raised, hundreds of thousands of people are going to face a tax bill because they didn't declare their income to their insurer. Tell us what this is
look,
about.
this is, again, the part of the means testing of the rebate meant that those on incomes over 84,000 for a single will no longer get it. They had to tell their insurer about that. If they don't, they've been paying 30% less for their premiums. The tax man will get that back at the end of the year. Many people don't know, so they could be up for some hundred, sometimes even a few $1,000s. So again, part of the problem is people aren't engaged with private health insurance. It's set and forget. They just pay it, and this can be a nasty surprise. So again, I would just suggest to people, contact your insurer today, ask them if they know if you should tell them if you should get the 30% rebate or not.
Okay, make the phone calls. Thank you very much, Christopher Zinn, this morning. And to register for the Big Health Insurance Switch, simply go to the Sunrise website. Follow the links. Christopher will be back soon with more on how to get the best from private health insurance and find the best cover for you.